the biggest issue we have right now is that there are a lot of people who are in need of psychotherapy and mental health treatment, but the options for some people are fewer because they don't have insurance, or they don't have community mental health agencies available in available slots for individuals. So this is not a common, this has been a common struggle since the beginning of time, essentially, services meeting up with the demand. And because more people are realizing the importance of mental health treatment, this is why the demand has gone up as well. There's still some level of stigma with when we talk about mental health treatment. However, that stigma is very much kind of chipped away in relationship to in relationship to people understanding the importance of seeking help when you need help. There are crisis centers, crisis help. So if you're in crisis, if you have something that's very immediate for yourself, you can call a crisis hotline. Now, the crisis hotline will help you, just as it says, in the crisis moment. And then the hopes is that the hotline worker will get you into some mental health treatment. And then in case of emergency, if you're feeling suicidal, or that you're feeling that things are spiraling out of control, then you can go to the emergency room for help. But even with the emergency room nowadays, there's waits. And usually for the emergency room, if your condition is considered more life-threatening, that's how you get triaged into the emergency room. So, unfortunately, these are the kinds of things that happen. And really unfortunate would be if you had a mental health breakdown, a nervous breakdown, or a psychotic episode, and you gotten picked up by the police. And I don't know how effective the system here in Hawaii is in relationship to people who may be suffering from mental health issues and getting arrested and going through adjudication and getting treatment in the OCCC versus going to Hawaii State Hospital. I don't know what that transition is nowadays. In the past, because I worked at Hawaii State Hospital, in the past, most of our patients came after a court hearing. They came in, the judge deemed them incompetent to stand trial. They needed treatment to understand even their proceedings, and they would get transferred to our crisis unit. And they would stay on the crisis unit anywhere from 30 days to 6 months or 8 months in relationship to how well they would recover from their particular mental health treatment. Particular mental health condition, whether they were compliant with treatment or not. Because even if you were picked up for some disturbing the peace and you went in for a court case, for a hearing for your case, and the judge deemed you incompetent to stand trial and sent you to Hawaii State Hospital, you would still have to voluntarily take medication, participate in treatment. The state hospital couldn't force treatment upon you unless the judge said in admitting you to the hospital that you had to be mandated to take medications. A lot of people don't know, even if you're in the mental hospital, that you have the right to refuse treatment. Now, what that does for you if you're adjudicated means that you may spend more time in the hospital. It may negatively impact your case. So oftentimes individuals, when they're initially come to the hospital, they're given a shot, or if they agree to take medications, that will begin to start clearing their mind and if they are readily participate in what we call the milieu, the treatment options that are available for the individual, and then the individual can start getting better, and then they'll go back to court for the court proceeding. So insanity and being insane are really two different things, depending on if you're talking law or psychology. Because in the law, in forensic psychology, when we talk about people's mental health, it's very different in terms of how we discuss it when we talk about psychopathology. Okay, on Monday I talked about the long history of mental health treatment, and in the early days we had asylums, and there were no medications, so there was a lot of treatments that were ineffective for individuals suffering from mental health. And people who had mental health issues or had developmental disabilities were really thrown away out of society and were treated very inhumanely. And then in the 1700s, 1800s, we had this kind of hygiene movement where people in asylums, the individuals working with people in the asylums felt that they should not be mistreated. They shouldn't be treated like animals or like inhumane. And so this whole movement of changing asylum care a revolution of changing asylum care came into play. The United States had several mental health institutions, some notorious mental health institutions. When I first started teaching this section of mental health treatment history, long time ago, I had a VH tape that I used to stick in the VH tape player, which don't even exist any longer. I think you might be able to find some somewhere. But it was a documentary it was done by a woman. It was a documentary that she did about, I think, 4 or 5 people she knew who had gone through mental health treatment in the 60s and the 70s. Because I'm sure this was in the 90s when I was teaching this with a VHS, I know for sure. And the other day I was thinking about it and I was trying to remember the name of it because it was such a very good piece, and see if it's on one of the documentary services or on YouTube. And I can't think of the name to save my life, but the director basically suffered from depression herself. And so she interviewed a number of individuals who had struggles with their mental health. And there was a woman who was diagnosed with schizophrenia at the time. They were all in the Northern California area. There was a woman who had dissociative identity disorder, multiple personalities. There was the producer themselves who had depression. And I think there was one other person in the piece, I can't remember. But what was really striking about it, because a lot of times, and not so much in your generation, but students that I was teaching in the 90s and early 2000s, there was a lot of stigma around mental health and what mental health was about. And most people felt that people who were mentally ill were people who were very decompensated and, quote, crazy and doing erratic stuff, when in fact, anyone can have a mental health condition, a mental health diagnosis. All you have to do is look in the mirror, and that could be someone who has a mental health diagnosis. But the stigma was so great, especially in the 80s, 70s, and the 80s about mental health, that a lot of people didn't seek out mental health treatment. Or if they did seek out mental health treatment, it was individuals who had a lot of access, people who had a lot of money and access to go into, very posh facilities, or see therapists, more than once a week, and pay $200 and $300 an hour. And what's really been interesting kind of having mental health treatment has always been over $100. As long as I can remember, as long as I've been in the field, people who are in private practice doing therapy have always charged over $100. Even when I was going to therapy back in the early 90s, my therapist was in New York City. Maybe that has something to do with it, but I know I was paying, if I wasn't paying $100, I was paying darn close to it, probably 85, 75, which would be equivalent to $100 today. So these prices that private practice therapists charge have been the ongoing prices. And there's pros and cons to that, because you have to think of the therapist who is seeing individuals. They're seeing usually more than one person a day. And this is their job. This is their income. So, even though it may be seem very expensive to the individuals coming to therapy, and as a young man said in the video, going to see a therapist can be a privilege, which is very true. Especially if you're seeing one in private practice, it's kind of that balancing of the scales. Now, most people who are professional people do see some people, what we call pro bono, which means that the person can come based upon their income and get free services. Usually, however, people who are in private practice, like mental health professionals who are private practice, they do that in relationship to some kind of community service. So it's not necessarily a person coming to the private practice and getting free therapy. The other thing that therapists do, mental health professionals do, is what we call sliding fee scale, which is based upon your ability to pay and your income. I used to go to a chiropractor when I lived in Savannah, Georgia, who basically allowed you to pay what you could afford and what you felt that was fair for services. And so you could pay whatever amount you felt that was fair and just based upon the treatment that you were getting for them and based upon your income, which I found to be really great and helpful. And of course, those who had very steady incomes would probably pay more than a person who didn't. And when I went, I looked up how much chiropractors usually would get, and that's what I paid, because I was in the position to pay as if I was an insured person, because I was an insured person at the time. So, all right. So I talked about kind of the disparity. We have health disparities as a whole. But let's talk a little bit about finding a therapist and who your therapist should be, or how do you know you have a good fit with your therapist, especially if you're paying for it. Now, when it comes to community mental health services or services that you're receiving at reduced scale or for free, you may not have a choice in terms of who your therapist is, because you may be going to a community agency, put on a waiting list, and when your number is up for the waiting list, then you get assigned a therapist. So as a result of that, you don't necessarily get to choose who you want to see. Now, if you are paying for your services, then you can be a little bit more discerning in the therapist that you're seeing. Many therapists allow consultation appointments. Usually they're 10 or 15 minutes long, where you could they'll introduce themselves, talk a little bit about their therapeutic model, how they conduct therapy, get a little insight into why you're coming to therapy or seeking out therapy. And even with that consultation, sometimes it's longer than 15 minutes. On average, it's 15 minutes. You can kind of get a feel for the person that you're talking to. And a lot of people worry about kind of confidentiality and issues about, who's going to find out about my therapy, and who will know about my therapy. And we live on an ethics code in terms of mental health professionals. Now, there are some limits to what we call confidentiality. And limits to confidentiality vary from state to state because there's state laws related to confidentiality. And essentially, the limitations with confidentiality tend to evolve around if you are harming someone or threatening someone. Say you come into therapy and say you want to kill somebody, or you're thinking about killing somebody, or you're threatening to kill someone, then there's a limit to confidentiality in some states where we have what we call duty to warn the individual that has been targeted, if we know the individual who is being targeted, or let resources know that this individual is targeting people. The other limits to confidentiality is if you're trying to harm yourself. If you come in and say, I'm going to commit suicide. Not that you're feeling suicidal, but you're going to actually talk about you're going to commit the act. You have a plan, you have an intent, as it's referred to. And then the therapist can hospitalize you or put you on what we call a psychiatric hold to make sure that you don't hurt yourself and you get some immediate treatment. The other limit to confidentiality is around children. If you are harming children, abusing children, then that's a limit to confidentiality. Even if we suspect that you are abusing, harming, exploiting children in some way, mental health professionals are usually mandated by law to report even suspected child abuse. So those are the limits to confidentiality that mental health professionals have. The only difference is if you go to clergy. So if you go to your pastor or your priest, they have more confidentiality than mental health professionals, okay, because of the nature of what they're doing. However, your clergy, some clergy have been trained in mental health counseling, what they call pastoral counseling, but pastoral counseling also has its limitations in relationship to mental health issues. So, depending on who you're seeing, which may be a choice that you were considering, if you wanted to see a social worker, a licensed social worker, mental health counselor, marriage and family therapist, have group therapy, individual therapy, seeing a psychiatrist, a psychologist, depending on what mental health professional you're going to see and how they are trained will depend on what kind of treatment you'll get as well. So all those things are important, but for the most part, for the person who is seeking out mental health professionals, especially if they're in crisis, they're more concerned about relieving some of their feelings and some of the pressures that they are experiencing. So it's not so much, I don't care what my therapist looks like or what kind of therapy they do or what kind of mental health professional they are. I just want some help with my mental health. And other times people are seeking out specific things about their mental health professional. I get calls all the time from people and emails from people asking, do you know a Black therapist? Because they're Black people and they want to have a Black therapist. And, sometimes I can help them out, sometimes I can't. Most of my friends who are in private practice who are Black have very full loads. They're seeing all kinds of people, especially now because there's a great demand for therapeutic services. And so as a result, you only have so many hours a day that you can see individuals and so many days of the week that you can see in individuals. And many people have their mental health treatment from 5 p.m. into 11 p.m. because many people are working individuals. Now there are services like Talkspace and Better Health that you can do mental health, and you can base it on your schedule. So you could do it during your lunch hour, or if you have some time during the day, or in the evening, or the weekends, it would be based upon your schedule. So some mental health professionals, some which I wouldn't recommend, work 7 days a week, or some mental health professionals may have, they only work during day hours, or from 12 to 6, or 6 a.m. to 12 noon, or 6 a.m. to 3, or 3 to 10. You know, it all depends on the person's schedule. That's one of the nice things about being a mental health professional. If you're a entrepreneur, if you have your own practice, is that you can set your times of treatment for yourself around your own schedule as well. Okay. Anybody have any questions, comments at this point? Just giving you some more insights about mental health treatment and possibly seeking out mental health treatment on your own. You can put it in the chat in a private message to me if you want to, or you can share with the class if you want to. I hope if you are having any difficulties or had difficulties in the past, that you consider seeking out some mental health options for yourselves. We even have a wellness center at Honolulu Community College, which can assist you in getting services for mental health, so which are free. So and you all the four-year universities. So if you are also taking classes at the four-year universities, Hilo, West Oahu, and Manoa, all three of those campuses have mental health wellness services available as well, free to students. Okay, so when we talk about mental health services, what are we talking about? Well, there's two versions of when we talk about mental health treatment. And the two versions are psychotherapy and biomedical interventions. And psychotherapy is what mental health professionals do. The psychotherapy is done by psychologists, marriage and family therapists, licensed professional counselors, licensed social workers. All these individuals do some kind of therapeutic, have some kind of therapeutic model. Now, when you talk about psychiatrists, social workers, marriage and family therapists, they have specific therapeutic models that they learn through their education that is focused on their particular field. So psychiatrists tend to have a very narrow psychotherapeutic window that they use, because primarily they're the medication manager of your mental health treatment. So there are some psychiatrists who do sit and talk to individuals on a monthly basis in some cases, or bi-monthly basis, or tri-monthly basis, and will sit and have a session with their clients. But most individuals, mental health professionals who will see people more often, will be psychologists, marriage and family therapists, mental health clinicians, licensed professional counselors, licensed social workers. Now, some of the advantages advantages between the various mental health services is what they can provide. Say if you're going to a licensed social worker and you need help, say for instance, with federal services like SNAP, EBT, then they will understand the system to get you to those services more so than a psychologist. A psychologist who may be working community mental health and work with those services may understand, but most psychologists don't work in those systems. So the licensed professional social worker would probably be able to get you into governmental services or extension of services related to your daily living needs, versus maybe a psychologist who hasn't dealt with those kinds of services in the past. So there's pros and cons to, you know, your mental health professional in terms of their scope of knowledge and their scope of practice. Now, there are over 500 plus psychotherapeutic models that a person who is a mental health professional can utilize to help individuals with their mental health. So psychotherapy is a psychological treatment, okay? And we use various methods to help someone with their psychological diagnosis or the psychological problems. And they also, psychotherapy is used to enrich your lives as well. You can go to therapy without being in crisis, as you heard in the video that I played at the beginning of the class. You can go to therapy if you're having thoughts about, what am I going to do next? You can go to therapy if you feel like you're stuck. There's a number of ways to implement kind of your mental health. Even if you feel like, you're not feeling anxious or depressed, but you're just feeling stuck in your life, and you're like, I feel like I'm going nowhere, but it's not causing you, loss of sleep or any of those symptom sets that we saw and the disorders that we talked about last week and the week before, then you can go into coaching. There's a whole segment of life coaching, which these individuals are not mental health professionals, but they help you kind of manage your life, and can be a very good alternative for you. And if you go to a life coach professional or coaching professional, if you demonstrate that you need mental health help, they will refer you to mental health services, because most of us don't practice out of our level of competency. Okay, there are people out here who have done unethical things. Okay, and if they are governed by a body like licensure and reported, because you can report a person to their licensure board and they get a review. And if they have been found to violating ethics, then they can have some remediation or the license taken away. Only way you really get your license taken away if you're a licensed professional is if you commit a felony. So if you commit a felony of some sort, then you can lose your license to practice. And that means that you've gone through the court system in relationship to your behavior, and that behavior that you've gone through the court system also impacts your ability to practice in the field that you've been licensed to be practicing. Okay. So I say all that because there are a number of psychotherapies, and here we have psychodynamic therapy, play therapy, which we often do with children, behavioral therapy, which is based upon classical conditioning, and we do behavioral therapy with autism spectrum and children, with pets, animals, and human beings. Cognitive therapy, which is about your thinking and thought processes. Cognitive behavioral therapy is a combination of behavioral therapy and cognitive therapy, which we look at your behaviors and how your thoughts are pushing or preventing or inhibiting your behaviors. And then humanistic therapies are really very personal, client-centered, acceptance kinds of therapies. Now, within all these therapies listed that you see, there are subcategories that fall into these kinds of therapies. There's family therapy. There's probably over 300 types of family therapies that marriage and family therapy and couple therapists use. But these listed tend to be the main kind of therapeutic models. Now, the other thing about psychotherapy is that psychotherapy, some psychotherapeutic models or techniques are better than others, depending on what condition or what diagnosis or what mental health condition the person is suffering from. Now, there are therapists, especially in my generation of becoming psychologists, many psychologists would study under one therapeutic model, and that's the therapeutic model that they would use the rest of their lives. So if I started doing my therapy in, say, I graduated in 1992. So when I graduated in 1992, if I studied psychodynamic psychotherapy If I was trained by psychodynamic psychotherapists, then I would be a psychodynamic psychotherapist. So clients who, if I was in private practice, clients who would come to me, I would say, I do psychodynamic psychotherapy, which is a talk therapy, which is based upon unconscious processes and early childhood experiences. And it takes a relatively long time for us to unravel some of the mental health issues that you may be experiencing. So this is going to be a process for you and me to go through for an extended period of time. And then we would talk about how long. We would say for 52 weeks, 54 weeks, 72 weeks, 24 weeks, usually not the case, but brief psychodynamic therapy could be 24 weeks. But it would be some finite kind of period of time or infinite period of time, depending on what model of psychodynamic therapy that I would be using, okay? And I would do that for the rest of my life. I would be a psychodynamic therapist. So everything, anytime a person would come to me with their mental health, I would look at it from a psychodynamic perspective. Now, there are therapists that do that. Nowadays, there are therapists who are just trained as cognitive behavioral therapists, CBT. This is all they do is CBT. So when a client comes to them, they're going to be using cognitive behavioral therapy techniques. And each one of these therapeutic models has certain things that you must do in the practice of the psychotherapy. This is how we are trained as mental health professionals in a therapeutic model. We learn what the ins and outs, what the roles, what the steps of treatment with that therapeutic model is. And it's systematic. This is why it's so important to go to a mental health professional, because we're trained to diagnose and recognize mental health conditions through psychopathology, okay? And then we'll employ the best form of treatment for your psychological disorder. This is what we do nowadays. My generation didn't do that so much in their psychotherapy, because the model of training has changed too, as over time. So even though I was trained in a more flexible model, even though I was trained in this flexible model, when I went for my final training as a psychologist, the people who were training me were not in the flexible model. So I was pigeonholed into a therapeutic model that I had to learn and practice during my training session, okay? But once I moved out of my training session, then I could go back and do and modify what I wanted to do, because I had completed my training and my degree, okay? So it is very important, if you're seeking out mental health treatment, to get the right fit. It's just like going to the grocery store. If you've been going to the grocery store, or even if you're ordering your groceries, some people are like, I don't order certain things because I want to see what I'm getting, okay? So for some individuals, like if you go to the produce section, and you go to the produce section and you pick up your produce, I use my little teddy bear, I pick up my produce, what do? I look at it, I inspect it, okay? And I determine I'm going to put that in my cart, okay? That's the same way you would do your mental health professional. If you get an appointment and you talk to them for, one session or the consultation, and you're like, I just don't, the vibe or something about them, I just doesn't fit with me. It's okay to say, I'm not going to come I don't want to be a client of yours. The mental health professional is on, the person who's giving the services. You're the client, so you have a choice of how you want to be seen. Now, you don't have that choice if you're adjudicated by the court. If the court says you have to go to therapy, usually they'll tell you where you have to go and when you have to go, so you don't have any choices. But if you go to mental health, community mental health, you probably won't have any choice of your therapist, because you're going to be assigned a therapist. So, but outside of those, if you're paying for it, or you are coming out of pocket, or your insurance is paying for it, then you have more flexibility. And that's where the privilege comes into play. Unfortunately, like the young man said in the video, that privilege plays a significant role in mental health treatment. And this is very true. I mean, there's no secret about that. And hopefully we get better in terms of funding and opportunities for mental health treatment. I'm more of a pessimistic person when it comes to that, because I've been in this game for a very long time, and I think we always will be struggling to meet the demand, unfortunately. Okay, so like I said, there's over 500 plus psychotherapeutic models, but these are some of the basic ones that we have. If you remember Sigmund Freud, we've talked about Sigmund Freud this semester quite often. Psychoanalysis and psychodynamic therapy is based upon Sigmund Freud's work. And like I said, it's a long-term therapeutic model. Usually you're with your psychoanalyst for years. When I was being trained as a psychologist, one of my classmates, my internship mates, was in psychotherapy. I trained on the East Coast. I trained in New Jersey. And the East Coast of the United States at the time, in the early 90s, was heavily influenced by psychoanalysis and psychodynamic therapeutic models. Matter of fact, all my supervisors were psychoanalytic, psychodynamic people. I had taken one course in psychoanalysis or psychodynamic therapy when I was before I got to my internship. So I knew the basis. Of course, I had stuff like this in undergrad, but it's a different thing when you get to professional school. And so I spent a whole year learning this whole psychotherapeutic model and being supervised under this model. So I feel very comfortable doing psychoanalysis and psychodynamic therapy. I'm not a big fan of it. I think there's other therapeutic models that work more effectively and more efficiently for individuals. But I understand the importance of this kind of therapeutic model. And part of the therapeutic model is the relationship that you have with the patient. And the idea is that they often, what we call, transfer their feelings onto you, negative or positive, and your goal is to reflect those back to them to understand that they are transferring these feelings, these actions, these thoughts that they have onto me, when in fact they need to be dealing with them themselves. And a part of dealing with these kind of transference of feelings and thoughts, we allow the person just to freely flow and talk, come in, choose what they want to talk about, and whatever comes to mind, which is what we call free association. And so free association is just allowing the person to talk. And as they talk, we pay attention to what the individual is bringing up. If there's some themes, if we see some reoccurrence of the transference issues. And we also ask them about their dreams and dream analysis. So for some people, this is a very good therapeutic model. If they want to go slow, they're very introspective. It was often deemed as the model of the rich and infamous, because it cost a lot of money, because it took such a long time to go through the process. Some people would even see their psychoanalyst 2 and 3 times a week. So, and some people still do that. It's not necessarily a very efficient model, I would say, but it can suit some people as well. The most popular model, I would say, therapeutic model nowadays is cognitive behavioral therapy. And the reason why cognitive behavioral therapy is one of the most popular models, CBT is one of the most popular models, is because there has been a lot of research around cognitive behavioral therapy's effectiveness. And what When we do that, we talk about therapeutic models being empirical or evidence-based, meaning that researchers, clinical researchers, have looked at these therapeutic models in a therapeutic setting and have proven or have evidence to show that they work in improving the individual's quality of life. So CBT, cognitive behavioral therapy, and behavioral therapies, the behavioral therapies, both have been seen as evidence-based therapeutic models. So nowadays, you have a lot of individuals who will receive CBT therapy. Here in Hawaii, the training schools, the schools that are training psychologists, University of Hawaii, University of Hilo, Chaminade University, most of these universities who are training psychologists are using cognitive behavioral therapists. Now, Chaminade also has a marriage and family therapy program. And there is a cognitive behavioral marriage and family therapeutic model. I don't know too much about the marriage and family models because I'm not a marriage and family teacher, or I've never been through a marriage and family therapy program. However, I do know the marriage and family therapy programs do have therapeutic models that they use. And some of them are cognitive behavioral based models, okay? They just have certain names. And there's a different governing body. They're not governed by the American Psychological Association. They have their own association for marriage and family therapists, just like social workers have their association for social workers, and just like psychiatrists have their association for psychiatrists, okay? So cognitive behavioral therapy is abbreviated as CBT, and it involves your emotions, your thoughts, and your behaviors. If you remember reciprocal determinism, when we talked about Bandura, so a lot of this is taken from some of the early theorists who would talk about psychology in general. So a lot of people have a disconnect with their emotions. And a lot of people are in their head with their thoughts and not connecting their thoughts, their thinking ability with their emotions. Because your intellect and your emotions are two different entities when we talk about psychological health. And a lot of times people will intellectualize their issues or their problems. So intellectualizing is essentially where you kind of talk about your issues without the connections of how it makes you feel. You talk about what you've done and how you handled, but you don't do the connection to when this is happening to me, I want to cry, okay? You may talk about, well, I cried and I felt sad, but you don't connect that emotionality with driving your thoughts. So the goal of CBT is to help you connect your emotions and not let your thoughts override those emotions that influences your behaviors. And a lot of times individuals will use a lot of what we talk, like I said, intellectualizing to prevent that growth and development in themselves. Oftentimes people, because there's so much in their head and their thoughts, that they go to the extremes. There's all or none, it's either this or that. There's no in between. And part of CBT helps you understand that life is varied. Things happen. Things don't always happen the way you want them to happen, that we have to have some level of flexibility. And having flexibility doesn't mean failure or success, okay? There are oftentimes people who are eligible for CBT therapy are individuals who are suffering from depression. Eating disorders are good for CBT. There's dialectical behavioral therapy, DBT, which is good for borderline personality disorder, but it has a lot of the same CBT kind of techniques. And you're going to be an active participant in your therapeutic process. So you will have homework, you will have challenges. And a lot of times, if you are feeling uncomfortable, in your mental health treatment, that's often an indication that you're making progress, because you're probably dealing with some things that you've never dealt with before, and it's making you feel uncomfortable and uneasy. But the goal is to work through that and understand how that may be influencing your mental health. Then we have the humanistic therapies. The behavioral therapies are often around classical conditioning. Exposure therapy is a big one. So these exposure therapy is exposing people gradually to the thing that they're fearful of. If you've ever watched Hoarders Buried Alive, they're using exposure therapy because they're making the person clean out their house. They're making the person deal with their hoarding behavior. This is what exposure therapy is. It's a very intense process. It usually is pushes the individual, but we push the individuals. Also, we're there to help the individuals and help them push themselves so they can overcome some of the things that have been challenging for them. And then play therapy is what we use for children. There's non-directive play therapy and directive play therapy. And oftentimes, because children have limited verbal abilities and the intellectual capacity to sit down and talk to about their feelings, play therapy is a good method to getting to some of those underlying feelings a child may have. And they use toys and activities, outdoor activities. I did a rotation with kids, and I played basketball with my kids to find out what was going on with them. Mainly, I was treating kids who had been abused. So we often did therapies that they felt comfortable with and that they enjoyed. So I played a lot of basketball. I played checkers. I played what's the things with the, I can't even think of the name of the game anymore, but it was a lot of hands-on games because social media, cell phones, and all those things didn't exist back then. So kids weren't preoccupied with those things. Now we have the humanistic therapist, and the humanistic therapist is essentially brought about by Carl Rogers. He's the most famous humanistic therapist, and his humanistic therapy was called client-centered therapy. And the therapist basically uses the technique of active listening, okay? And this is a therapist who will often restate and reframe and clarify what you have been talking about. This is a very popular therapeutic model. Most therapists outside of the psychology realm will use like mental health professionals, social workers, some marriage and family therapists will use client-centered therapy. There is, I'm trying to think of the name. It's called, one of my good friends uses this therapeutic model. It's an acceptance model where you basically help the client improve their lives based upon where they are, okay? You don't push them to go from one direction to the other. Where they are, what they're coming with, this is what you work with, and help the person grow and move and develop better mental health based upon where they are and what they're bringing to the table. So it's a very humanistic kind of model. And I can't think of the name of it. I'll tell you all on Monday what it is. Okay. What is it called? What is it called? Let me see if I can search here. Therapy. Come on, keyboard. Therapy models. Therapy modalities. Let's see what comes up here. There it is. First one to come up because it's very popular. Acceptance and commitment therapy, ACT. I have quite a few friends, especially my friends who have been doing therapy for a very long time. Many of them were cognitive behavioral therapists or dialectical behavioral therapists. and they have gone into doing acceptance commitment therapy. So I think it has a lot of CBT basis, but a little bit more flexibility. So as you see here, we have a number of various therapeutic models: internal family systems, trauma-focused therapy, structural family therapy, strength-based therapy, solution-based brief therapy, rational life, psychodynamic, personal family-centered therapy, object relations, which comes out the psychodynamic school, existential phenomenological psychotherapy. I had a professor who was an existential psychologist. I hated his course. It's just like, I'm not thinking about all that. Emotionally focused therapy for couples, dialectical behavioral therapy, which I mentioned before, neurofeedback, narrative therapy, multicultural therapy, modern psychoanalytic therapy, mindfulness-based cognitive therapy. So there are a number of therapeutic modalities. This is from a particular counseling center, but gives you an idea of kind of the various modalities that we have for therapy. So you can find a therapist that is in one of these modalities, and it may be the modality that you enjoy and work for yourself. But in most cases, most individuals are using cognitive behavioral therapy. So here's another from Psychology Today. It talks about the types of therapy. So you see, we have dance therapy, art therapy, coaching. This is what I referred to before. It's like if you're not really having mental health issues, but you're just having some life issues, coaching may be a good option for you. Music therapy. I have a friend whose daughter was having some issues. She's a preteen, and they decided to use equine assisted therapy with her. And she's doing pretty well with that. That equine assisted therapy is using horses as a therapeutic model. So sand play, reality therapies, hypnotherapy, transpersonal, strength-based. I mean, there's a number of therapeutic models.